Good evening, ladies and gentlemen, moms and dads, grandmas and grandpas. I'd like to welcome you to the Healthy Start webinar presentation of sleep disordered breathing and what we can do for your child. We live in such an incredible world, those of us who are a part of the Healthy Start, and we are world changer kind of organization, because we encounter situations each and every day where there is a child who could benefit by what Healthy Start can do. And if you're tuned in tonight, well, you probably have a child that you're concerned about. Maybe you heard something about how there may be a solution for some of the things that you've noticed in your children. You're going to learn tonight about the symptoms of sleep disordered breathing and what is a comprehensive solution, basically a cure for all the things that you may be seeing in your child. And as you're watching, I'm going to encourage you to take some notes. And also, you'll notice that there's an opportunity to ask questions, a little chat window. Don't hesitate. Go ahead and send us your questions. And by the time we get to the end, I think that you'll see that we're going to answer most everything that will occur to you. But those things that we don't answer, if they're generic, we'll come back, talk about them. And if they're really sensitive areas, we can go ahead and respond to you privately by sending you an email. There are a lot of doctors on our team and on our staff, and they're definitely all involved and all in helping you find solutions. We're going to start out with the number one doctor, the number one world changer. That's the founder and the inventor, a board-certified orthodontist. This is Dr. Earl Bergerson, CCDDS, MSD, ABO. He has had an incredible life and an incredible journey. This has been an adventure that he's taken the whole world with him on. And if you're just finding out about it now, let me tell you that there are stamps of many countries. He has been manufacturing an appliance that's both orthodontic and orthopedic and taking it all over the globe in 37 countries. But let's go back a little ways and talk about how this was all developed. He was the president of his dental school class in 1955. I was born a year later. Okay, this man has really committed himself. He's been very focused. He's entrepreneurial. He is a disturbing to a profession kind of person that has kind of disrupted the entire practice of dental and orthodontics by what he's invented and what it's evolved into. But he's been a leader from the very, very beginning. And as you look at his history, you see that that is absolutely the case. He was a chairman of the Orthodontic Alumni in 1965. You see all the different societies, and that he was also a professor at Northwestern University in Chicago. What's interesting about that is for 25 years he taught there, but in about 25 days he's going to be returning to the classroom because he's going to do what we call the ultimate lecture. That is going to be on August 4th and 5th. And he will be recognized for the 50 years that he is committed to changing children's health all over the world. Well, health in general, but most specifically, and where you and I are concerned, children's health. So the ultimate lecture is going to be an opportunity for some of the alumni to come back and earn credits once again in his classroom by seeing what he has been developing over the last 50 years. So again, Northwestern University, you can see all of the different accolades, but really what I want you to know is 3.5 million children have been treated by these appliances, and their attributes are perfectly safe. There are no BPAs, no latex, no silicone. They're FDA approved, Health Canada certified, equivalent of a Class 2 medical device. So what he has developed functions very highly. It's a very advanced, kind of highly engineered thing that will actually help change the face and the orientation of the inside of a child's mouth, all for the better and all more or less the way nature intended. Who's going to tell you a little bit more about that? Well, that is one of our premier doctors. This is Dr. Diana Batoon, DMD. Now, she started out born in Portsmouth, Virginia. She grew up in the San Diego area. You can see that she completed her BA in microbiology, University of San Diego. And then she received her doctorate at Tufts University School of Dental Medicine. She's also completed her general practice residency at the VA Hospital, Loma Linda, California, in the LA area. 1996, she moved out to Scottsdale, Arizona, where she lives with her husband and her 3 boys. You'll hear about them. But also she started a practice, Bonita Dentistry, and she's got a thriving practice there. I know some of the patients and the moms that I've sent her way, all with just glowing response. But she continues with this continuing education by being a member of the American Academy of Cosmetic Dentistry. She's part of the SPEAR Education Faculty Club, American Academy of Cardiovascular Sleep Medicine, member of the American Dental Association. She's active in her community, and she's really about bringing awareness. That's why we're all here tonight. We want you to be aware of what she has learned in her own family, with her own boys, and in her practice. And as she takes this story, not only across the world in a webinar like this, but across the world, literally, as far, I think, recently as Manila. So I think that you're in very good hands. I'm going to turn it over now to our wonderful premier doctor. This is Dr. Diana Batoon. Go ahead, share your screen, Diana. Can't wait to hear your story for all the parents tonight.
Thank you, Kathy. I am very excited to be here. In fact, it's just a great amount of information that we have to share tonight. There's so many children out there that we can help. And what we know is that sleep disordered breathing is a silent crisis among today's America's children. Look at this chart, a bunch of those symptoms. I know that you know one or more children that may be experiencing one or more of these symptoms. It's amazing. We have so many children that are diagnosed now with ADD, ADHD, that have chronic allergies or that have a history of asthma, that have difficulty in school, and that may struggle with bedwetting. But you know, an estimated 9 out of 10 kids suffer from one or more of these symptoms. That's very shocking. The research over the past 20 years has linked each of these conditions to a common root cause. We know that as sleep disordered breathing. So we're going to talk about the options that parents have nowadays to help their children. Well, they're going to rely on drugs. They're going to rely on prescription drugs, maybe even put their children through psychiatric testing, counseling, whether that's in school or outside of the school environment, surgery such as tonsil adenoid removal, sleep studies where children will actually have to spend the night in a sleep lab so they can be evaluated on how well they sleep. Allergy testing. There are so many children that go through that to find out what types of foods, environmentally, what they're allergic to. And also, if their children are struggling in school, special education tutoring and resorting to sleep aids. We know many adults who have sleep apnea are actually relying on that nowadays. Well, these conventional treatments, what do they have in common? They only address the symptoms and not the root cause. And again, they're short-term answers. They often involve several drugs that may have many side effects, and they also may cost a lot of money, may be time-consuming for the family. And most of all, but most disappointing, is it could prove ineffective. So our healthcare system today simply doesn't have great solutions in our society and our Western world. So how can dentistry help? Well, dentists. We have the knowledge, and other dentists around the globe have the knowledge and tools to impact the development of a child's airway, to increase the oxygen intake. I mean, on average, a child may see a dentist, a pediatric dentist, twice a year at least, every 6 months. And it's been challenging to watch some of these children struggle with some things like mouth breathing and how it affects their body and their mental awareness. Well, now it's more important than ever to pay attention to this, because it's not just about cavities anymore and straight teeth. It's about the overall well-being of a child and their success, their potential to thrive and be successful in our community, in our society. So let's take a look at these pictures. Here are 2 children, and I would challenge you, I would ask you, do these children look healthy to you? Look at their eyes. Number one, to me, they look very tired. They don't look happy. There's some other things that may be going on, but we don't know about it. But clinically, physically, it looks like something may be going on with these children. Let's take a look at their profiles. Here's some other children. When you look at the profile of a child, that really can tell us a lot. It can tell us about the jaw relationships between the top jaw and the bottom jaw. And what it means for us is what's really happening to the airway behind that jaw relationship. Is there a restriction happening? Does a child have a narrow upper arch? What does their nasal floor look like? Is that child struggling with breathing through their nose? We know that nasal breathing is actually very healthy, whether it's for a child or an adult. But here's an opportunity for us as parents, as healthcare providers, as grandparents, as adults to pay attention to someone we know that may be struggling in their sleep cycle, that may be struggling in school or struggling to breathe properly. So what are the root causes of sleep disordered breathing and sleep deprivation in children? Well, we're trying to create, and HealthyStart is a big part of that plan, to create a greater awareness of some of the severe effects that sleep disordered breathing can have on children and their health. We know that mouth breathing doesn't allow the tongue to be positioned in the correct position. It causes a reduced airway. I see so many children, they'll be watching their electronics, playing on their electronics. They'll be sitting in school. They'll be sitting in my waiting room, and they are mouth breathing. What I mean is their lips are not closed. They are physically, visibly opened mouth, breathing through their mouth. They may have habits like finger sucking, may have an improper swallow. These are the children that maybe we pay attention to, and every time they eat, they smack their food, or as parents, we're constantly having to remind them to close their mouth when they chew their food. Some of those other root causes, it causes an upper arch constriction and a high palate. When that happens, it decreases nasal breathing. That in turn reduces REM sleep. We all know REM sleep is very important, but in children, it's going to affect their development and their brain function. It affects their immune system. It prevents them from fighting illnesses or viruses or colds that are out there. And it can cause multiple behavior and social symptoms. This is a diagram of the cranial growth. So we know there's a window from ages 2 to 17 where the head is still growing. So for a child, as they're growing, as they're developing, as their brain is developing, there are certain things that we can do to help maximize the airway. But at 12 years old, 94% of the average female, their craniofacial growth is complete. And 89% of those males at 12 years old, their craniofacial growth is complete. So once the head stops growing, then really that's exactly where the airway is going to stay. But that's where HealthyStart comes in. It's a solution to help prevent children from having any airway issues as an adult. Normal growth and development of the face and jaw is forward and downward. But, we ask ourselves, why are so many of today's children not experiencing normal growth and development? Well, let's talk about that. There was a study done by Dr. Robert Corcini, and he did a population study, and his conclusions came to the conclusion that dietary consistency and toughness can promote proper bone growth and proper permanent tooth eruption. So what does that cause? It causes the jaws to be in proper position, to be in an ideal relationship so that food can be processed properly, and that the eruption of all those permanent teeth can occur in a normal pattern. But in our Western society, there are a lot of processed foods, and we all know that, right? Nowadays, kids don't have to use their jaws, their tongue, or their teeth. The types of foods that they have out there for toddlers actually melts on their mouth. So they're never really exercising their tongue or exercising their jaw. So what we've noticed is the percentage of what we call malocclusion or crooked teeth is increasing. And he found out that in the first generation, 50% of those caused malocclusion. The second generation, there was a higher percentage of 70%. And in the third generation, 85%. And that's why we see so many children needing intervention as far as braces, functional appliances. You'll see thumb sucking devices out there now. You'll see space maintainers because children are losing their teeth prematurely. So we want to pay attention to an infant's development from the beginning. And part of that is paying attention to the eruption of their first permanent teeth. So as you know, as parents, as people out there who have children, we know that the prolonged use of a pacifier should be no longer than 6 months. To try to get them to start drinking out of a cup, even prolonged bottle use can cause constriction in the jaws. It can affect the way that permanent teeth erupt and form. So let's look at this 5-year-old. You look at his teeth and you go, oh, they're nice and straight. Oh, it's great. But some of the problems that we have to ask ourselves is when the permanent teeth come in, which are actually longer, taller, wider, is this child, this 5-year-old, going to have enough space? When we look at that picture to the lower right, is his tongue going to have enough space? Some people may say, oh, the teeth are so perfect, they're perfectly aligned. But what we do know is as the head grows down and forward, that then that expansion, that growth is going to create space so that when the permanent teeth erupt, we want them to have room to erupt in a straight pattern. There are some things that we need to pay attention to, and the most important thing is the airway. We know that for children to breathe properly, there cannot be any obstruction in the nasal cavity. There can't be any swollen adenoids or tonsils that can constrict the airway. Then we have to pay attention to the tongue position. When a child sleeps and is mouth breathing and they have their mouth open, the tongue is going to typically fall back. That can constrict the airway. So if in the beginning a child already has a restricted airway, is it going to become more restricted when they fall down, lay down to sleep, and the tongue falls back? Children who have hoarse voice or children who have recurrent ear infections, the question becomes, are they breathing through their nose? Or are they predominantly mouth breathing during the day and at night? So what's important to note is Dr. Gilmignon, who was from Stanford University, and we call him the sleep god. He actually has so many studies, has written so many articles about sleep, which suggests that the maxilla is really the key to improving sleep disorder breathing, and that when patients have constrictions in their upper and lower jaws, that can be an indication that they are not breathing properly. We need the maxilla to expand. We need that maxilla, the upper jaw, to move down and forward, to grow out, to expand, so there's enough room for most of the teeth in the permanent dentition to erupt, and without any constriction or without any rotations, that it can come straight down without the improper placement of the tongue, so that there is no obstacle, that the teeth come out and they're not pushed by the thumb sucking, they're not pushed by any other finger sucking or any habits of where the teeth cannot erupt in a straight pattern. Here's a lateral ceph. It's an airway of a 10-year-old. On the left side, you see that we have a nice normal airway developing. And that's what you'd like to see in all children. But in reality, there are some children that have a restricted airway. You can see right here, it's the most restricted portion, is this child may struggle with breathing properly at night and then having inadequate oxygen during their REM sleep cycle. So that translates into the profile picture that we see here. This is a child that has normal development where we would expect to see their airway to be nice and patent. And then an underdeveloped jaw where you might see a little bit of constriction like we did in the prior picture. Well, what happens is mouth breathing is going to cause an improper air exchange, and that constriction, does not improve in 82% of the population of kids that are 2 to 12. And that's where HealthyStart comes in and can really help those children. Here is the window of opportunity to correct the growth of the jaw, to help the teeth erupt in a straight pattern, and to help the airway become more patent and maximize so that the children can sleep well at night. And all the hormones that are excreted by the pituitary gland and other parts of our brains can actually work and function properly.
Listen to this mother describe her baby's sleep disorder breathing.
Yeah, there you go.
Now watch what happens when she's able to open the airway by simply shifting the position of his jaw.
Now watch what happens when I take his jaw. I just bring it forward. If I can, let's see if I can. I open his airway. Just bring his airway forward. Now listen to the quiet breathing. There we go. Now he's breathing through his nose.
That video, every time I watch it, is it's very powerful, because there are actually children that breathe like that. And a lot of parents, to be honest with you, we don't watch how our children sleep. I'm a parent. And it's very important, unless that the child has breathing like that, that a parent is more aware of it. But there are many children out there that are not sleeping as good as they could be. So what should a child's airway look like? We really want it to look like a garden hose, not so much like a coffee stirrer stick. If you imagine, everybody, whether from the time that they're a child or an infant, should really have a nice airway developing. Here is a chart that really explains how sleep disorder breathing, how it's a cycle. When you have underdeveloped dental arches and jaws, and some of these things, is caused by poor tongue position, a lot of soft diet, poor oral habits, that can cause a compromised airway. With a compromised airway, we might expect to see swollen tonsils in the back. We might expect to see inflammation within our body that manifests as eczema or asthma, respiratory conditions. That child that always gets croup every winter, right? That child that once they have a cold, it manifests and proceeds into an ear infection. Or that they have cross bites, or they have an anterior open bite from thumb sucking or other habits. But that compromised airway can cause sleep disorder breathing. That in turn causes these symptoms. And a lot of these symptoms we see in a lot of children in our society today, like nightmares, like consistent sleep talking, sleepwalking, bedwetting. Those are some of the things that parents don't openly share, but they deal with it on a daily basis. And that's where HealthyStart and its system of functional appliances can help eliminate, if not most or all of those symptoms that you see up top over here. So what can a dentist possibly do about this epidemic of sleep disorder breathing in children? Well, they can fix it. And here's how. The HealthyStart system. In fact, HealthyStart has treated over 3.5 million cases worldwide. It's not just in the US, it's all over. It's FDA approved, like Kathy Turner mentioned. There are over 500 US and international patents on this system, which is truly amazing. A lot of research has gone into this system. And what's most important is it has helped so many children that moms are talking about it. Moms are mentioning it to their other friends, because you don't like to talk about it when your child's struggling with it openly. But what you do is you share with the success that they're experiencing after putting their child into a HealthyStart system. Ortho-Tain, which is the parent company, developed HealthyStart and is growing at a rapid pace. So that's what we are creating today. We are trying to create that awareness among the community, among parents, among grandparents, because there are so many children that are experiencing the things we just went through that we can help. and it's an easy task. It is bringing them to a certified provider who's a dental provider that is experienced in training or who's trained in HealthyStart that can treat the children. So what does HealthyStart do, you ask? Well, it expands the dental arches. It is a more natural way of expanding the dental arches without the use of heavy wires. There are certain things in dentistry that maybe children who have ADD or who are autistic or who are on the spectrum or who may have some other conditions, medical conditions that may not make it comfortable for them to have something wired in their jaw. Okay, it also establishes nasal breathing. If you read a lot of the articles that are out there, and anybody can Google nasal breathing, that is really the key to healthy people. It's really a key to healthy children. It's really the key to healthy growth and development because it discourages or eliminates mouth breathing. I challenge you, put your tongue to the roof of your mouth right now and picture how you're breathing, or tell yourself how you're breathing. Most of us are going to be breathing through our nose. If there is no obstruction in the nasal cavity, we should be breathing through our nose. And what that does is it allows that air to filter all the bacteria that we encounter every day, whether it's environmentally or through our food or diet, whatever it is. Then that air, which is healthy air, is assimilated in our lungs, and that way it can moisturize our body. And that's why we do not see children who are nasal breathing have issues with eczema or skin inflammation in the body. The other thing that HealthyStart can do, it can train the tongue, believe it or not. The way the appliances are designed, it positions the tongue in the correct position, prevents any anterior tongue thrust. And what I mean by that is the tongue moving forward, sticking out. It strengthens the tongue and conditions it to be in the proper position, but it promotes proper swallowing and speech. Those children that you hear that you cannot understand them, either they're lisping, their R's, their W's, certain things they cannot pronounce in a normal fashion. There are a lot of things happening. One of them is they may have an improper swallow or a tongue tie. We don't know. The other thing HealthyStart can do is it can eliminate the bad habits. I don't know if you guys remember, but it used to be when children used to thumb suck, there is a wired device, and they still do it for some instances, but not so much anymore, where they'll stick a wired contraption in there. It prevents every time the child would want to put the thumb in there, it would hurt. And that's not fun for some children. And I don't know about you, but most parents today are looking for things that are more natural, that are less invasive. And that really, when HealthyStart developed the system, it really created an environment in a dental setting that prevented a child from having many fears of going to the dentist. The other thing that HealthyStart can do, it can eliminate that tongue thrust. We talked about the swallow, and eliminate an open bite. It also can advance that lower jaw, which we call the mandible, so that the teeth interdigitate in the proper position, that teeth land in flat spaces, and that there are no rotations, and they stay there. It always will encourage proper facial and body growth. And one of the things that it does is when you're nasal breathing, the amount of growth hormone that's secreted by the brain is secreted in proper amounts. So that child that maybe may be the shortest child in the classroom, you know, the question would be, how are they sleeping at night? It also corrects most orthodontic conditions to a class 1. And everybody likes that, right? Every parent wants their child to have nice straight teeth. It does reduce the chance for orthodontic treatment later. And I know that firsthand. All 3 of my boys were put into HealthyStart appliances, and all of them do not need braces, thankfully. But what's great about it is they each dealt with issues, and one of them was snoring. A lot of parents will think that snoring is normal. It actually is not healthy. Snoring is not healthy for a child. It's not healthy as an adult, so it can't be healthy as a child. So it needs to be addressed. And when you address it at an earlier age, you just prevented that child from having a higher risk of having sleep apnea as an adult. And we know now sleep apnea in the adult population is a big industry. There are so many adults that have sleep apnea. And did you know that most of those adult cases had airway issues as a child? So let's look at Michael. Michael on the left, he was at age 9. He was put into the HealthyStart treatment. And at age 14, we're looking at his picture to the right. So at the left is when he started, and at the right is what he ended up with. And what I like about this picture is that there's a nice jaw relationship on the right, but there's no double chin anymore, right? We think this is cute. But actually, it really translates into something else going on behind there. And let's take a look at what that is. This is the same child. This is before, and this is his airway, okay? Afterwards, we improved his airway, and he's gonna stay that way. What's great about the HealthyStart is there is no relapse. Because you train the tongue to be in the proper position, and all the teeth have erupted into where it's going to be, then the cementum fibers, the fibers around the teeth actually mature and stay there. So the only reason why teeth get crooked is there's a habit. There's something going on. There's tongue pushing the teeth outward, and that's why some of the teeth are flaring out. Here's what his clinical pictures look like before and after. This case required no brackets or wires. Phenomenal. Great. Close the gap, what we call in dentistry a diastema. Straightened and improved his bite. So we see a nice arrangement of all his permanent teeth, and that there's room for all his permanent teeth, that no teeth are pulled. Back when, it used to be very common that if a child didn't have room in the dental arch, they would pull some of the permanent teeth. And as a dentist, what I find is that creates problems for those children as an adult with bite issues later on in life. So let's meet a healthier Michael. He definitely looks great. And you know what's great for every parent and as a dentist, the teeth are straight. His midline is right on. We call it midline. But what's great is he looks happy. He's a happy kid here. But we just made him a healthier child that's going to grow into a healthier adult. I love it. So 12 months in HealthyStart. Here's our clinical pictures. You can see right here, it looks like there's a V-shaped upper arch, and right here we widened it. We made it more like a U shape, and that's the way it should be. On the lower arch, you know, some of these teeth were coming in crooked. We straightened that out, but what's great to point out is there's enough room for the tongue. A lot of people will say, oh, you have a big tongue. Well, in fact, it's not that. There's a narrow archway that this is leaning, these lower teeth are leaning in, and that's why the tongue looks big. So right now, if you have a child and they're scalloping edges, looks like there's teeth marks on their tongue, they really don't have room, and they're not positioning their tongue in the right space. So they're probably mouth breathing. So sleep disorder breathing and ADD and ADHD, there's actually a link. And what's amazing is there are so many medical studies done on this topic. And for some parents, they resort to medication. And for some families, they start the medication at 5 years old. And then they're dependent on that medication as a teenager and sometimes as an adult. So Karen Bonuck, she has a PhD. She did a study on sleep disorder breathing and ADD. She polled over 11,000 kids, which is great. This study polls over a lot of children over 6 years, and it was published in the Pediatric Journal in 2012. What she found out was that sleep disorder breathing increases the risk of ADD, ADHD by at least 50%. Well, folks, that actually is a high amount. And there's so much that we can do to decrease that percentage and prevent children from being put on medication that they don't really need. The answer is they're not sleeping well at night. So to keep them functioning during the day, we're having to put them on medication to keep them going. And some of those kids, they have social issues, behavioral issues in the school environment. They struggle with getting along with their peers. They aren't the best athlete among different sports. And so that almost labels the child. And they're already struggling as it is. And to struggle in that environment, they're really not happy campers. But there's something that we can do for them, and that's the HealthyStart system. The other thing that HealthyStart does, and this is, I can attest to this personally among my boys, is that there is a link between sleep disorder breathing and bedwetting, right? It's such a taboo topic. Nobody likes to talk about it, especially if your child is 8 or 9 and they're still struggling with wetting the bed. The thing is, I'll ask parents, do they wet the bed? And they'll say, oh no, he wears a pull-up. Well, wearing a pull-up is actually bedwetting. At a certain age, a child should be able to sleep soundly without wetting the bed. And what we find is the reason why that happens is their mouth breathing at night. And so that reduced oxygen during their REM sleep actually affects those hormones, either on the adrenal glands or the hormones that are secreted by the pituitary gland that keep the bladder controlled or closed. So you can actually tell your child to stop drinking at 4 or 6 and still they'll have a bad accident. So let's talk about some case studies in HealthyStart. Here's a female. She started as 5 years old. And at 7 years old, you can kind of see, we talked about profiles, what this might look like, what her airway might look like. And also what I have been finding in most of the cases that I've been treating where they're mouth breathing is that they tend to have a forward head posture. And right here, when you look at her profile here, her posture is actually improved. And her jaw relationships have improved. And that's what these clinical pictures show, the improvement. What's great about this is that at 12 years old, these pictures are what her end result looks like, and that there's no relapse. Her teeth will stay like this for the lifetime. Here's another gentleman, started treatment at 12 years old, took about a couple of years, and you can kind of see there's some flaring of these front teeth. Well, with the HealthyStart system, we created that ideal relationship between the upper and lower jaw. And like I said, there was enough space for all the permanent teeth to come in and land in flat spaces or interdigitate where they should go. And there's no rotations. Amazing. There's no braces or wires in this case. Another case. 8 years old, here we see the spacing like that. Here we see almost a double chin that we talked about. So this lower jaw, the lower skin is coming down like that. Well, this is what clinically he looked like. And right here, straightened everything out, closed that gap. Part of that was probably because his tongue wasn't in the right position. But with HealthyStart, trained his tongue to be in the proper position, and all those teeth had room. The best thing about HealthyStart is it changes lives. I can't tell you the kind of relationships that we have at our office with children after they've completed HealthyStart. The families are so appreciative that, number one, not only is their child sleeping better, but the parents are sleeping better. They're actually not doing laundry at night from bedwetting the night before. They are actually feeling relaxed that their child can function in the school environment.
It unlocks their potential. If your kid is suffering because they can't breathe and is scientific, they can't get oxygen to their brain, I know that parents want to do whatever they can to help their kid be the best, grow the best that they can. And in this society, we do so many things geared towards that, and sometimes we think it's the best, and it may be from drug perspective, or like we're doing it because we think it's the best for your child. But that HealthyStart gives us a natural way to do this for our child, and not flood them with chemicals, and just deal with their own like way of growing, and just helping them grow, which, you know what, can make them smarter, make them not act out as much, and can make, them prettier. If you have everything in the right place, you are better looking plastic. I mean, it's awesome.
You know, she said it right there. There isn't very, there are so many things that a parent will do for their child. And that's because there's a role there. As parents, we're nurturing. We care for our children. We want the best for them. And what's amazing about Healthy Start is it's a solution that offers parents answers. It offers them a dental answer for to help improve or eliminate any medical condition or any growth and development issue that the child may be having at the time. So, Kathy, are you there?
You bet I am. And really, just always love to listen to the story. I want to share with you, in fact, from what you had just done, I'm going to share my screen. I'm going to come back and share with you a picture of one of the kids that you just kind of profiled, the little girl who went from 5 to 7. Now, I want you to tell everybody what you're seeing in this picture as you look at it when we add these lines. Now, you tell everybody how that kind of helps people get perspective on the change that happened.
Well, you know, part of this is that the face is divided into thirds, okay? And if you imagine that a lot of times a child that has sleep disorder breathing, they'll have like a sunken in middle third where it looks like they've got bags under their eyes. There's some darkness there. And it looks like they've got a flat front. And then the other thing that we notice is they've always got a retruded, and what I mean by retruded is pushback lip. And sometimes what we'll see in another case is we barely see the upper lip and we'll see so much of the lower lip rolled out. But what this translates to is that there is something that's pushing or causing the teeth to flare out a little bit. And it could be that she could have been a thumbsucker. The other thing could have been that she might have been a pacifier used for a long period of time, but that there's a constriction of this upper arch. Then what happens is the lower teeth kind of lean inward. So that's what we're seeing here. And then at the end of her treatment, and we're preventing this. This is a cure to prevent her from having a restricted airway. We're helping. The appliances actually stimulate growth of the maxilla and mandible. And there's a series of appliances, and they'll start with that, like a habit corrector first, to correct their habits if any need to be corrected. And then there are certain appliances that have tooth sockets that help the teeth find its home, that help it interdigitate and bite correctly into flat spaces. And so what's great about that is when we correct those front 6 teeth and the bottom 6 teeth, they've already got their 6-year molars in. We're going to make room for all the other teeth, especially the canine, the eye tooth that comes in last. We're going to create a space right here for this tooth to come in.
So the thing that's impressive to me is that if you look at the child on the left, it's the same little girl. She is who she is. You don't necessarily know what it is that you would, necessarily point to. Although the more accustomed you are to looking at this and you take a look at that upper lip, you can imagine what the dental orientation looks like. But if they did not intervene, if they did not start her at age 5, so that by age 7, you can already see the profile that maybe her genetic blueprint intended her to have. If you didn't do that, describe her future in terms of not just her appearance, but also her health, her breathing, her, what she'd be lined up for, dental needs down the road. What would happen if we miss this window?
Well, if we miss that window and they're chronic mouth breathers, they're going to have more issues with allergies. They're going to have more issues with battling with colds and viruses. The other thing that they're going to have issues with is, and I don't want to call it when children, especially girls, have a mixed bag of permanent teeth and baby teeth, and some of them are coming in crooked, you'd be amazed that some children are mean and they get mocked. They get made fun of because their teeth don't look pretty or they've got these funny crooked teeth. And for children, that kind of environment just affects their self-esteem, affects their confidence. But what we have set this child up for is to have a patent airway that allows her to breathe properly. And it also allows her to have good REM sleep with maximum oxygen, not just one night, every night. And so we would expect her probably to have better or do well in school. She might do well in sports. She might have better retention, better memory. Her speech would probably be better or improve. So there's some children that come into our office and actually there's nothing really wrong with them. And maybe the sleep questionnaire, the mom will say, well, they snore. But everything else, they do really well in school. And actually what we found is when we cure that mouth breathing, they don't snore anymore. It's very hard for a child with their lips closed to snore. If they do, there might be some issues where an ENT might need to be involved, where we need to look at the nasal cavity. We need to look at the adenoids. We need to look at the tonsils. There are so many reasons. There are other things that come into play. And that's why parents nowadays pay attention to the types of foods that their kids eat. They pay attention to what types of things they put as far as lotions, perfumes, those types of things. Also, drinking the right amount of water is really important. I mean, I'm talking to you from 100-degree Arizona. It's so important to hydrate our body, but what that in turn does, it gives us oxygen to breathe properly. So when our body does that on its own, then all the hormones that are responsible for growth, are responsible for development, memory, retention, computation, doing math problems, spelling, reading, actually, comprehension and reading. A child that does not sleep well at night actually struggles with reading or math. Or they might forget something. They might not understand something, might not be able to put 2 and 2 together. They don't know, they read a story, but they don't remember what happened in the beginning. We know there are so many hormones that are within the brain that are actually important as far as processing information. And there is some link to Alzheimer's brain and the types of plaques that we find in the brain, and also those brains that lack oxygen as they're developing.
Wow, everything that you said, can you believe the multitude of transitions that take place when you make these corrections, and simultaneously all these things are correcting. And I love the line that you use when you say, if you see crooked teeth, there has to be a habit behind it. And so that tells you that if there's a problem, we can fix it 9 out of 10. But now what we normally it doesn't happen that we talk so much about it. Would you mind sharing with the parents that are listening in tonight, when we're talking about where you're going to invest in your child's future, and we think of all the things that we want to do for our kids, we want them to have the nice clothes, go to the right school, be a part of the right social thing, get the right tutoring, play an instrument, all these things. But how you compare an investment here, and how does this compare, by the way, to other alternatives if you don't get this fixed and they end up with the braces and all these other, ongoing Band-Aid type treatments for the rest of their life. So how would you rank this as an investment for your child's future for the rest of their life? And how does the cost compare to other options?
Well, one of the things that I hear, and sometimes I'll have parents that come to me for a second opinion, is that actually the HealthyStart system is less than braces. And actually, there are some patients that I have that went through phase 1, that went through phase 2 ortho treatment, and then are coming back to me either for Invisalign or to correct the mouth breathing. The issue is, way back when, we didn't know how this tied into. We didn't know that grinding actually is a result of not having it's a restricted airway, we know now. Back then, we used to think that if children were grinding, they were stressed out. And now we know that that's not true. The medicine research proves and is documented to show that bruxism in children is actually a result of inadequate airway during sleep, most likely. And so when you pay attention to those things early on, you're just setting your child up for more successful things to happen in the future. And what I mean is that this type of investment, I don't know that there could be a price put on that. If you saw that your child was sleeping well, was growing properly, was doing well in school, was actually not having the issues as far as not behaving in school, that those all went away, that the symptoms of possible ADD, ADHD were present. That's the thing. There's a lot of misdiagnosis with that label. And what I know is if a child sleeps really well at night, those things go away. Their body actually calms down because all their muscles, all their tissues have enough oxygen in their body that things are restful, so that when they wake up and they are proceeding or going about their day, they're actually more alert. They're more happier. Or they're happier, I'm sorry. And so that translates into something I don't think a parent can put a price tag on. Everybody is happier overall. And I just see so much changes in a child when they start HealthyStart and when they end treatment, and their ability to cope. I mean, let's face it, there's so many pressures in society today. There's so many things. Kids have like 4 or 5 activities to do after school, let alone having homework for an hour and a half. So I think what's important to know is that you're improving their health without the use of medication, and you're not investing so much in drugs, not so much in phase 1, phase 2 type of treatment, that it all works out.
Well, to me, that it's a matter of fatigue, having a certain kind of pain, and to think that your child is carrying the weight of the world of that kind of pain every day. How can you run with a pack if you're running on empty? That's just the way. It's just such an impressive existence. So how you're sleeping, tell everybody on this sleep questionnaire what the value is. And as you said, we're parents, but we don't go in and watch them sleep. But this is important.
Right. I think why this is very important is because, like I said, parents do not watch their children sleep. So initially, we'll send home this questionnaire even before the child comes into the office to help evaluate. And we'll ask the parent, take 1 to 2 nights, watch your child when they're dead asleep, and just go through this and rank it from 0 to 5 and letting us know what you're observing. And then when they're in the HealthyStart system, after the follow-up, which is usually 2 to 3 months, we'll have the same parent fill it out. And what I always see is that there's an improvement where most of those 3s, 2s, 4s, or 5 go to 0. Or maybe the 5 went to a 1. And you see that in the child's attitude as well. So where they first came into the dental office, they couldn't sit still, they're fidgeting, they're crying, they're hyperactive, they're running up and down the hall, they can't sit still, and then 3 months later, they are sitting quietly. They actually come and sit in the chair by themselves. They don't need mom. They're not crying for mom. And I think that is helpful. The other thing is we'll see if they work with a speech therapist, we'll see improvement in that. And a lot of the other places that they work with, they'll wean off their treatments because they're getting better with their speech, or they're getting better with their hand-eye coordination, or their physical therapy, whatever they're doing. If they were weak on one side and all of a sudden, because they had the maximum amount of oxygen every night, their body gets stronger on both sides. And so the brain actually is doing what it's supposed to do. So this sleep questionnaire is very important.
I think that it is such a great baseline. And when you see all the questions and you listen to a presentation like this, I've never seen a parent not get it. They connect the dots. It all just makes sense. And once you know it, you can't unknow it. And I love listening to the way you put the information out there that you tell everybody. And if people have more questions, they can call our office. We're in 37 countries and we're here to help. It's 1-844-KID-HEALTHY, the HealthyStart, or HealthyStartChild.com. But our most important message, I think that we always want to leave you with, is that there is an answer, but you have to come and get the answer. So please don't wait. Diana, thank you so much. This is Dr. Diana Batoon for Healthy Start with the Parent Overview tonight on our webinar. We're here every Tuesday night, 8 p.m. Central. We'd like for you to join us. We'd love it if you would tell other parents that we're here with something really special for them to understand and apply in the right time frame while their children are still in their growth phase. And so for Dr. Diana Batoon, for Susie Lafredo, who is driving the technical side tonight, we'd like to say thank you. I'm Kathy Turner. So for Healthy Start, to all the parents and grandparents out there, thank you for being with us. And please remember, don't wait. Healthy Start. Good night now.